In Vietnam today, over 1 million children under the age of 6 are living in industrial zones. In a trend seen across Asia, young people are increasingly leaving their rural villages in search of work in factories. And in Vietnam, when they do so, they bring their children with them. When a young family leaves its home community, it's leaving behind an extended network of care for their child. Once inside an industrial zone, the only option for a young girl like Mai, when her parents are working long shifts at the factory, is home-based daycare, where one or two women are looking after up to 40 children for 14 hours a day. Home-based daycare providers are not required to have any background in early childhood development, and they're unregulated, which means that cases of abuse and neglect are sadly frequent, and even the best providers can't offer much in terms of true early education. OneSky has a proven track record in training caregivers. We've trained over 40,000 caregivers in China's state-run welfare institutions, and we've helped influence policy to create changes in systems of care for vulnerable children in that country. We know we can do the same in Vietnam. Our caregiver training is offered free of charge and delivered through a blended learning approach that utilizes technology to underscore in-person learning and home visits. Our online learning platform allows trainees to access continuing education courses, a video resource library, and expert advice long after their in-person training has ended. And most importantly, a community forum gives isolated caregivers a chance to network with others in their field. This January, we graduated our first cohort of 80 trainees in Vietnam and began training 240 more, benefiting 6,000 children in Da Nang province. These women now see themselves as early learning professionals. And the government of Vietnam has asked us to expand to 19 more provinces, ultimately benefiting 400,000 children in the next 6 years. They've also approved our curriculum for use across the country. Our team is made up of ECD specialists, as well as a researcher from Harvard School of Public Health. And as we move forward, scaling into new countries, we seek support from the Solve community to help us with technical needs around enhancing the user interface on our online learning platform and creating a system where we can replicate that platform more quickly and easily for each new country and context that we move into. We also seek support with data analysis and guidance as we look to develop a sustainable business model that moves away from pure philanthropy and looks to the brands that are producing in Asian factories as partners in funding these kinds of solutions. Thank you very much.